Hygiene, a set of practices performed to preserve health. According to the World Health Organization, WHO, hygiene refers to conditions and practices that help to maintain health and prevent the spread of diseases. Personal hygiene refers to maintaining the body's cleanliness. Hygiene activities can be grouped into the following: home and everyday hygiene, personal hygiene, medical hygiene, sleep hygiene, and food hygiene. Home and everyday hygiene includes hand washing, respiratory hygiene, food hygiene at home, hygiene in the kitchen, hygiene in the bathroom, laundry hygiene, and medical hygiene at home. Many people equate hygiene with cleanliness, but hygiene is a broad term. It includes such personal habit choices as how frequently to take a shower or bath, wash hands, trim fingernails, and wash clothes. It also includes attention to keeping surfaces in the home and workplace clean, including bathroom facilities. Adherence to regular hygiene practices is often regarded as a socially responsible and respectable behavior, while neglecting proper hygiene can be perceived as unclean or unsanitary, and may be considered socially unacceptable or disrespectful, while also posing a risk to public health. Definition and overview. Hygiene is a practice related to lifestyle, cleanliness, health, and medicine. In medicine and everyday life, hygiene practices are preventive measures that reduce the incidence and spread of germs leading to disease. Hygiene practices vary from one culture to another. In the manufacturing of food, pharmaceuticals, cosmetics, and other products, good hygiene is a critical component of quality assurance. The terms cleanliness and hygiene are often used interchangeably, which can cause confusion. In general, hygiene refers to practices that prevent spread of disease-causing organisms. Cleaning processes, example hand washing, remove infectious microbes as well as dirt and soil, and are thus often the means to achieve hygiene. Other uses of the term are as follows: body hygiene, personal hygiene, sleep hygiene, mental hygiene, dental hygiene, and occupational hygiene, used in connection with public health. Home hygiene overview. Home hygiene pertains to the hygiene practices that prevent or minimize the spread of disease at home and other everyday settings such as social settings, public transport, the workplace, public places, and more. Hygiene in a variety of settings plays an important role in preventing the spread of infectious diseases. It includes procedures like hand hygiene, respiratory hygiene, food and water hygiene, general home hygiene, hygiene of environmental sites and surfaces, care of domestic animals, and home health care, the care of those who are at greater risk of infection. At present, these components of hygiene tend to be regarded as separate issues, although based on the same underlying microbiological principles. Preventing the spread of diseases means breaking the chain of infection transmission so that infection cannot spread. Targeted hygiene is based on identifying the routes of pathogen spread in the home and introducing hygiene practices at critical times to break the chain of infection. It uses a risk-based approach based on hazard analysis critical control point, HACCP. The main sources of infection in the home are people, who are carriers or are infected, foods, particularly raw foods, water, pets, and domestic animals. Sites that accumulate stagnant water, such as sinks, toilets, waste pipes, cleaning tools, and face cloths, readily support microbial growth and can become secondary reservoirs of infection. Those species are mostly those that threaten at-risk groups. Pathogens, such as potentially infectious bacteria and viruses, colloquially called germs, are constantly shed via mucous membranes, feces, vomit, skin scales, and other means. When circumstances combine, people are exposed, either directly or via food or water, and can develop an infection. The main highways for the spread of pathogens in the home are the hands, hand and food contact surfaces, and cleaning cloths and utensils, e.g. fecal, oral route of transmission. Pathogens can also be spread via clothing and household linens, such as towels. Utilities such as toilets and wash basins were invented to deal safely with human waste but still have risks associated with them. Safe disposal of human waste is a fundamental need, Poor sanitation is a primary cause of diarrhea disease in low-income communities. Respiratory viruses and fungal spores spread via the air. Good home hygiene means engaging in hygiene practices at critical points to break the chain of infection. Because the infectious dose for some pathogens can be very small, 10 to 100 viable units or even less for some viruses, and infection can result from direct transfer of pathogens from surfaces via hands or food to the mouth, nasal mucus, or the eye, hygienic cleaning procedures should be adopted to eliminate pathogens from critical surfaces. Hand washing, or hand washing, also called hand hygiene, is the process of cleaning the hands with soap or hand wash and water to eliminate bacteria, viruses, dirt, microorganisms, and other potentially harmful substances. Drying of the washed hands is part of the process, as wet and moist hands are more easily recontaminated. If soap and water are unavailable, hand sanitizer that is at least 60% V/V alcohol in water can be used as long as hands are not visibly excessively dirty or greasy. Hand hygiene is central to preventing the spread of infectious diseases in home and everyday life settings. Meta-analyses have shown that regular hand washing in community settings can significantly reduce respiratory and gastrointestinal infection. The World Health Organization, WHO, recommends washing hands for at least 20 seconds before and after certain activities. These include the 5 critical times during the day where washing hands with soap is important to reduce fecal-oral transmission of disease: after using the toilet, for urination, defecation, menstrual hygiene, after cleaning a child's bottom, changing diapers, before feeding a child, before eating, and before/after preparing food or handling raw meat, fish, or poultry. Regular hand washing with soap is one of the most effective ways to prevent the transmission of pathogens. It significantly reduces the risk of gastrointestinal and respiratory infections. Correct respiratory and hand hygiene when coughing and sneezing reduces the spread of pathogens, particularly during the cold and flu season. Carry tissues and use them to catch coughs and sneezes, or sneeze into your elbow. Dispose of tissues as soon as possible. Routine cleaning of hands, food, sites, and surfaces, such as toilet seats and flush handles, door and tap handles, work surfaces, and bath and basin surfaces, in the kitchen, bathroom, and toilet rooms reduces the spread of pathogens. The infection risk from flush toilets is not high, provided they are properly maintained, although some splashing and aerosol formation can occur during flushing, particularly when someone has diarrhea. Pathogens can survive in the scum or scale left behind on baths, showers, and wash basins after washing and bathing. Thorough cleaning is important to prevent the spread of fungal infections. Molds can live on wall and floor tiles and on shower curtains. Mold can be responsible for infections, cause allergic reactions, deteriorate/damage surfaces, and cause unpleasant odors. Primary sites of fungal growth are inanimate surfaces, including carpets and soft furnishings. Airborne fungi are usually associated with damp conditions, poor ventilation, or closed air systems. Hygienic cleaning can be done through mechanical removal, i.e., cleaning, using a soap or detergent. To be effective as a hygiene measure, this process must be followed by thorough rinsing under running water to remove pathogens from the surface. Using a process or product that inactivates the pathogens in situ. Pathogen kill is achieved using a microbiocidal product, i.e., a disinfectant or antibacterial product, waterless hand sanitizer, or by application of heat. In some cases, combined pathogen removal with kill is used, example laundering of clothing and household linens such as towels and bed linen. House deep cleaning, an intensive cleaning process targeting often neglected areas, enhancing aesthetics and improving health by reducing allergens and bacteria. It typically includes tasks like detailed dusting, appliance cleaning, and carpet shampooing, recommended biannually to maintain a home's hygiene and air quality. Laundry hygiene involves practices that prevent disease and its spread via soiled clothing and household linens such as towels. Items most likely to be contaminated with pathogens are those that come into direct contact with the body, example underwear, personal towels, face cloths, nappies. Cloths or other fabric items used during food preparation, or for cleaning the toilet or cleaning up materials such as feces or vomit are a particular risk. Microbiological and epidemiological data indicates that clothing and household linens are a risk factor for infection transmission in home and everyday life settings as well as institutional settings. The lack of quantitative data linking contaminated clothing to infection in the domestic setting makes it difficult to assess the extent of this risk. This also indicates that risks from clothing and household linens are somewhat less than those associated with hands, hand contact, and food contact surfaces, and cleaning cloths, but even so these risks need to be managed through effective laundering practices. In the home, this should be carried out as part of a multi-barrier approach to hygiene which includes hand, food, respiratory, and other hygiene practices. Infectious disease risks from contaminated clothing can increase significantly under certain conditions, for example, in healthcare situations in hospitals, care homes, and the domestic setting where someone has diarrhea, vomiting, or a skin or wound infection. The risk increases in circumstances where someone has reduced immunity to infection. Hygiene measures, including laundry hygiene, are an important part of reducing spread of antibiotic-resistant strains of infectious organisms. In the community, otherwise healthy people can become persistent skin carriers of MRSA, or fecal carriers of enterobacteria strains which can carry multi-antibiotic resistance factors, e.g. NDM1 or ESBL-producing strains. The risks are not apparent until, for example, they are admitted to hospital, when they can become self-infected with their own resistant organisms following a surgical procedure. As persistent nasal, skin, or bowel carriage in the healthy population spreads silently across the world, the risks from resistant strains in both hospitals and the community increases. In particular, the data indicates that clothing and household linens are a risk factor for spread of S. aureus, including MRSA and PVL-producing MRSA strains, and that effectiveness of laundry processes may be an important factor in defining the rate of community spread of these strains. Experience in the United States suggests that these strains are transmissible within families and in community settings such as prisons, schools, and sport teams. Skin-to-skin contact, including unabraded skin, and indirect contact with contaminated objects such as towels, sheets, and sports equipment seem to represent the mode of transmission. During laundering, temperature and detergent work to reduce microbial contamination levels on fabrics. Soil and microbes from fabrics are severed and suspended in the wash water. These are then washed away during the rinse and spin cycles. In addition to physical removal, microorganisms can be killed by thermal inactivation, which increases as the temperature is increased. Chemical inactivation of microbes by the surfactants and activated oxygen-based bleach used in detergents contributes to the hygiene effectiveness of laundering. Adding hypochlorite bleach in the washing process achieves inactivation of microbes. A number of other factors can contribute, including drying and ironing. Drying laundry on a line in direct sunlight is known to reduce pathogens. In 2013, the International Scientific Forum on Home Hygiene reviewed 30 studies of the hygiene effectiveness of laundering at temperatures ranging from room temperature to 70 degrees Celsius 158 degrees Fahrenheit, under varying conditions. A key finding was the lack of standardization and control within studies, and the variability in test conditions between studies such as wash cycle time, number of rinses, and other factors. The consequent variability in the data, i.e., the reduction in contamination on fabrics, in turn makes it extremely difficult to propose guidelines for laundering with any confidence. As a result, there is significant variability in the recommendations for hygienic laundering given by different agencies. Medical hygiene at home. Medical hygiene pertains to hygiene practices that prevent or minimize disease and the spreading of disease in relation to administering medical care to those who are infected or who are more at risk of infection in the home. Members of at-risk groups are cared for at home by a carer who may be a household member and who requires a good knowledge of hygiene. People with reduced immunity to infection, who are looked after at home, make up an increasing proportion of the population, as of 2009, up to 20%. The largest proportion are the elderly who have comorbidities that reduce their immunity to infection. It also includes the very young, patients discharged from hospital, taking immunosuppressive drugs, or using invasive systems, etc. For patients discharged from hospital, or being treated at home, special medical hygiene procedures may need to be performed for them, such as catheter or dressing replacement, which puts them at higher risk of infection. Antiseptics may be applied to cuts, wounds, and abrasions of the skin to prevent the entry of harmful bacteria that can cause sepsis. Day-to-day hygiene practices, other than special medical hygiene procedures, are no different for those at increased risk of infection than for other family members. The difference is that, if hygiene practices are not correctly carried out, the risk of infection is much greater. Chemical disinfectants are products that kill pathogens. If the product is a disinfectant, the label on the product should say disinfectant or kills pathogens. Some commercial products, e.g. bleaches, even though they are technically disinfectants, say that they kill pathogens but are not actually labeled as disinfectants. Not all disinfectants kill all types of pathogens. All disinfectants kill bacteria, called bactericidal. Some also kill fungi, fungicidal, bacterial spores, sporicidal, or viruses, virucidal. An antibacterial product acts against bacteria in some unspecified way. Some products labeled antibacterial kill bacteria while others may contain a concentration of active ingredient that only prevents them from multiplying. It is, therefore, important to check whether the product label states that it kills bacteria. An antibacterial is not necessarily antifungal or antiviral unless this is stated on the label. The term sanitizer has been used to define substances that both clean and disinfect. More recently, this term has been applied to alcohol-based products that disinfect the hands, alcohol hand sanitizers. Alcohol hand sanitizers, however, are not considered to be effective on soiled hands. The term biocide is a broad term for a substance that kills, inactivates, or otherwise controls living organisms. It includes antiseptics and disinfectants, which combat microorganisms, and pesticides. Personal hygiene involves those practices performed by a person to care for their bodily health and well-being through cleanliness. Motivations for personal hygiene practice include reduction of personal illness, healing from illness, optimal health and sense of well-being, social acceptance, and prevention of spread of illness to others. What is considered proper personal hygiene can be culture-specific and may change over time. Practices that are generally considered proper hygiene include showering or bathing regularly, washing hands regularly and especially before handling food, face washing, washing scalp hair, keeping hair short or removing hair, wearing clean clothing, brushing teeth, and trimming fingernails and toenails. Some practices are sex-specific, such as by a woman during menstruation. Toiletry bags hold body hygiene and toiletry supplies. Anal hygiene is the practice that a person performs on their anal area after defecation. The anus and buttocks may be either washed with liquids or wiped with toilet paper, or by adding gel wipe to toilet tissue as an alternative to wet wipes or other solid materials in order to remove remnants of feces. People tend to develop a routine for attending to their personal hygiene needs. Other personal hygienic practices include covering one's mouth when coughing, disposal of soiled tissues appropriately, making sure toilets are clean, and making sure food handling areas are clean, besides other practices. Some cultures do not kiss or shake hands in order to reduce transmission of bacteria by contact. Personal grooming extends personal hygiene as it pertains to the maintenance of a good personal and public appearance, which need not necessarily be hygienic. It may involve, for example, using deodorants or perfume, shaving, or combing. Hygiene of internal ear canals. Excessive cleaning of the ear canals can result in infection or irritation. The ear canals require less care than other parts of the body because they are sensitive and mostly self-cleaning. there is a slow and orderly migration of the skin lining the ear canal from the eardrum to the outer opening of the ear. Old earwax is constantly being transported from the deeper areas of the ear canal out to the opening where it usually dries, flakes, and falls out. Attempts to clean the ear canals through the removal of earwax can push debris and foreign material into the ear that the natural movement of earwax out of the ear would have removed. It is recommended that all healthy adults brush twice a day, softly, with the correct technique, replacing their toothbrush every few months. 3. There are a number of common oral hygiene misconceptions. The National Health Service, NHS, of England recommends not rinsing the mouth with water after brushing, only to spit out excess toothpaste. They claim that this helps fluoride from toothpaste bond to teeth for its preventative effects against tooth decay. It is also not recommended to brush immediately after drinking acidic substances, including sparkling water. It is also recommended to floss once a day, with a different piece of floss at each flossing session. The effectiveness of amorphous calcium phosphate products, such as tooth mousse, is in debate. Visits to a dentist for a checkup every year at least are recommended. Sleep hygiene is the recommended behavioral and environmental practices that promote better quality sleep. These recommendations were developed in the late 1970s as a method to help people with mild to moderate insomnia, but, as of 2014, the evidence for effectiveness of individual recommendations is limited and inconclusive. Clinicians assess the sleep hygiene of people who present with insomnia and other conditions, such as depression, and offer recommendations based on the assessment. Sleep hygiene recommendations include establishing a regular sleep schedule, using naps with care, not exercising physically or mentally too close to bedtime, and avoiding alcohol as well as nicotine, caffeine, and other stimulants in the hours before bedtime. Further recommendations include limiting worry, limiting exposure to light in the hours before sleep, getting out of bed if sleep does not come, not using the bed for anything but sleep, and having a peaceful, comfortable, and dark sleep environment. Personal care services hygiene. Personal care services hygiene pertains to the care and use of instruments used in the administration of personal care services to people. Personal care hygiene practices include sterilization of instruments used by service providers including hairdressers, aestheticians, and other service providers. Sterilization by autoclave of instruments used in body piercing and tattooing. Cleaning hands. Challenges. Excessive body hygiene is a possible sign of obsessive, compulsive disorder. Neglecting bodily hygiene, or the cleanliness of one's environment, may be a sign of major depression and other psychological disorders. Although media coverage of the hygiene hypothesis has declined, popular folklore continues to sometimes assert that dirt is healthy and hygiene unnatural. This has caused health professionals to be concerned that hygiene behaviors which are the foundation of public health are being undermined. In response to the need for effective hygiene in home and everyday life settings, the International Scientific Forum on Home Hygiene developed a risk-based or targeted approach to home hygiene that seeks to ensure that hygiene measures are focused on the places and times most critical for infection transmission. While targeted hygiene was originally developed as an effective approach to hygiene practice, it also seeks, as far as possible, to sustain normal levels of exposure to the microbial flora of our environment to the extent that is important to build a balanced immune system. Although there is substantial evidence that some microbial exposures in early childhood can in some way protect against allergies, there is no evidence that humans need exposure to harmful microbes, infection, or that it is necessary to develop a clinical infection. Nor is there evidence that hygiene measures such as hand washing, food hygiene, etc., are linked to increased susceptibility to atopic disease. If this is the case, there is no conflict between the goals of preventing infection and minimizing allergies. A consensus is now developing among experts that the answer lies in more fundamental changes in lifestyles that have led to decreased exposure to certain microbial or other species, such as helminths, that are important for development of immunoregulatory mechanisms. There is still much uncertainty as to which lifestyle factors are involved. Medical hygiene. Medical hygiene pertains to hygiene practices related to the administration of medicine and medical care that prevents or minimizes the spread of disease. Medical hygiene practices include isolation of infectious persons or materials to prevent spread of infection, sterilization of instruments used in surgical procedures, proper bandaging and dressing of injuries, safe disposal of medical waste, disinfection of reusables, i.e., linen, pads, uniforms, scrubbing up, hand washing, especially in an operating room, but in more general healthcare settings as well, where diseases can be transmitted. Ethanol-based sanitizers. Most of these practices were developed in the 19th century and were well established by the mid-20th century. Some procedures, such as disposal of medical waste, were refined in response to late 20th century disease outbreaks, notably AIDS and Ebola. Culinary hygiene, or food hygiene, pertains to practices of food management and cooking that prevent food contamination, prevent food poisoning, and minimize the transmission of disease to other foods, humans, or animals. Culinary hygiene practices specify safe ways to handle, store, prepare, serve, and eat food. Food safety, or food hygiene, is used as a scientific method/discipline describing handling, preparation, and storage of food in ways that prevent foodborne illness. The occurrence of two or more cases of a similar illness resulting from the ingestion of a common food is known as a foodborne disease outbreak. Food safety includes a number of routines that should be followed to avoid potential health hazards. In this way, food safety often overlaps with food defense to prevent harm to consumers. The tracks within this line of thought are safety between industry and the market and then between the market and the consumer. In considering industry-to-market practices, food safety considerations include the origins of food including the practices relating to food labeling, food hygiene, food additives and pesticide residues, as well as policies on biotechnology and food and guidelines for the management of governmental import and export inspection and certification systems for foods. In considering market-to-consumer practices, the usual thought is that food ought to be safe in the market and the concern is safe delivery and preparation of the food for the consumer. Food safety, nutrition, and food security are closely related. Unhealthy food creates a cycle of disease and malnutrition that affects infants and adults as well. In developing countries, or low and middle-income countries, universal access to water and sanitation, coupled with hygiene promotion, is essential in reducing infectious diseases. This approach has been integrated into the Sustainable Development Goal No. 6, whose second target states, by 2030, achieve access to adequate and equitable sanitation and hygiene for all and end open defecation, paying special attention to the needs of women and girls and those in vulnerable situations. Due to their close linkages, water, sanitation, hygiene are together abbreviated and funded under the term WASH in development cooperation. About 2 million people die every year due to diarrheal diseases, most of them are children less than 5 years of age. The most affected are people in developing countries who live in extreme conditions of poverty, normally peri-urban dwellers or rural inhabitants. Providing access to sufficient quantities of safe water and facilities for a sanitary disposal of excreta, and introducing sound hygiene behaviors are important in order to reduce the burden of disease. Research shows that, if widely practiced, hand washing with soap could reduce diarrhea by almost 50% and respiratory infections by nearly 25%. Hand washing with soap also reduces the incidence of skin diseases and eye infections like trachoma and intestinal worms, especially ascariasis and trichuriasis. Other hygiene practices, such as safe disposal of waste, surface hygiene, and care of domestic animals, are important in low-income communities to break the chain of infection transmission. Cleaning of toilets and hand wash facilities is important to prevent odors and make them socially acceptable. Social acceptance is an important part of encouraging people to use toilets and wash their hands, in situations where open defecation is still seen as a possible alternative, e.g. in rural areas of some developing countries. Household water treatment and safe storage ensure drinking water is safe for consumption. These interventions are part of the approach of self-supply of water for households. Drinking water quality remains a significant problem in developing and in developed countries. Even in the European region, it is estimated that 120 million people do not have access to safe drinking water. Point-of-use water quality interventions can reduce diarrheal disease in communities where water quality is poor or in emergency situations where there is a breakdown in water supply. Since water can become contaminated during storage at home, e.g. by contact with contaminated hands or using dirty storage vessels, safe storage of water in the home is important. Methods for treatment of drinking water at the household level include chemical disinfection using chlorine or iodine, boiling, filtration using ceramic filters, solar disinfection. Solar disinfection is an effective method, especially when no chemical disinfectants are available. UV irradiation. Community or household UV systems may be batch or flow though. The lamps can be suspended above the water channel or submerged in the water flow. Combined flocculation/disinfection systems available as sachets of powder that act by coagulating and flocculating sediments in water followed by release of chlorine. Multi-barrier methods. Some systems use two or more of the above treatments in combination or in succession to optimize efficacy. Portable water purification devices. Hard toilet soap with a pleasant smell was invented in the Middle East during the Islamic Golden Age when soap making became an established industry. Recipes for soap making are described by Muhammad ibn Zakaria al-Razi, c. 865-925, who also gave a recipe for producing glycerin from olive oil. In the Middle East, soap was produced from the interaction of fatty oils and fats with alkali. In Syria, soap was produced using olive oil together with alkali and lime. Soap was exported from Syria to other parts of the Muslim world and to Europe. Two key Islamic innovations in soap making was the invention of bar soap, described by al-Razi, and the addition of scents using perfume technology perfected in the Islamic world. By the 15th century, the manufacture of soap in Christendom had become virtually industrialized, with sources in Antwerp, Castile, Marseille, Naples, and Venice. In the 17th century, the Spanish Catholic manufacturers purchased the monopoly on Castile soap from the cash-strapped Carolinian government. Industrially manufactured bar soaps became available in the late 18th century, as advertising campaigns in Europe and America promoted popular awareness of the relationship between cleanliness and health. A major contribution of the Christian missionaries in Africa, China, Guatemala, India, Indonesia, Korea, and other places was better health care through hygiene, and introducing and distributing soap and cleanliness and hygiene became an important marker of being identified as a Christian. Many religions require or encourage ritual purification via bathing or immersing the hands in water. In Islam, washing oneself via wudu or ghusl is necessary for performing prayer. Islamic tradition also lists a variety of rules concerning proper hygiene after using the bathroom. The Baha'i faith mandates the washing of the hands and face prior to the obligatory Baha'i prayers. Orthodox Judaism requires a mikveh bath following menstruation and childbirth, while washing the hands is performed upon waking up and before eating bread. Water plays a role in Christian rituals as well, and in certain denominations of Christianity such as the Ethiopian Orthodox Tewahedo Church, which prescribes several kinds of hand washing, for example after leaving the latrine, lavatory, or bathhouse, or before prayer, or after eating a meal, or ritual hand washing. Thank you for watching this video.